First experience with PrEP from my country. So, here are my disclosures. To start with some, brief summary of epidemiology of HIV in Czech Republic, we got some kind of, 3,000 of patients all around the country. HIV care is concentrated into the 8 HIV clinics, and incidents, a number of new cases in the last few years was ranging from 150 to 200 of new patients. But I have to say that in 2017 and 18, we've seen a significant decrease of incidents independent from the PrEP, because at that period of time, there were only few, PrEP users. The decrease in persons are, like 11 to 13%. But I'm absolutely sure that together with, successful implementation of PrEP, we can be even more successful in fighting the AIDS epidemic and HIV. What about the PrEP history? That was already mentioned, the European approval for Truvada as a PrEP tool. Following this, there was a huge discussion in my country, especially among the HIV clinicians, and it was not easy to persuade, especially the first generation of HIV clinicians about especially the pros of PrEP. There were many aspects, in ethical and financial and medical level, but finally we've succeeded, and right now PrEP is taken as a routine and a standard part of HIV care. In November 2017, we've published the first guideline, a national guideline for using PrEP, and since that time, very not quickly, but the number of PrEP users is started. But same as HIV care, the PrEP care is concentrated into the HIV centers provided by HIV clinicians, which we see as a best option, because we're experienced with all the entry trials and also the routine and regular checkups put together with a PrEP prescription. The PrEP is not covered by health insurance or covered by state until now, and I don't expect this will change in a close future. But what is very positive, that in the last 12 months, the price of a PrEP, together with the generics coming to the market, dropped down robustly. So right now, the price of monthly generic Truvada is around 45 euros. It's not covered, but I don't see this as a huge barrier, because a year ago, 12 months ago, it was like 500, which was absolutely unacceptable by the potential PrEP users. What is also positive is that the clinical and the laboratory checkups are completely covered by health insurance, and as I told you, it's concentrated in 8 HIV centers, so HIV clinicians are prescribing PrEP in my country. Unfortunately, we don't have a national database, so we don't have accurate data to publish and to analyze. But I was trying to contact all participating center, a few days ago, and as far as we know, the official users of PrEP in our country are plus and minus 150. What about the unofficial ones, especially in a period of time like 1 or 2 years ago, probably a similar comparable number of PrEP users was so-called unofficial people buying, the Truvada on internet, or taking the medication from their friends or from abroad, where the prices were dropped down, prior to changes in the market. What about the normal PrEP user is mostly MSM, living in large cities with multiple sexual partners and with a history of any STI or modern STIs. during the process of implementing a PrEP, we've discovered several cases of HIV infection. So people who are not anymore put in the program of PrEP anymore, then they involved in HIV care. And only official approach to PrEP in Czech Republic is a daily use. On-demand approach is not recommended, but as far as we know, some of the patients, they are using or they prefer this option. Looking at the retention of care, most of the, more than 80% of our PrEP users are retaining in a care, and they are using a PrEP for more than a year, for more than 12 months now, plus and minus 80%. To getting a better feedback, we're right now, trying to participate or starting our participation in a, international project by, Danish colleagues called PrEP. So maybe, within some period of time, we'll have more data, not only from Czech Republic, because I think that availability of accurate data is the only way to analyze the situation and to improve the situation if needed. Thank you.